Hi everyone, this is Kate Warnock, standing here with our keynote for day 3 of Emerging Minds, Dr. Stephen Chan. Stephen, welcome.
Nice to be here. This is impressive. Such a wonderful venue.
Oh, well, thank you so much. Well, talking about wonderful, I know from the social chatter, that happened during your presentation about really the future of digital health and how it's going to intersect with mental and behavioral health. You've blown some minds today, which is precisely what we were hoping you would do. So maybe you could recap for us, Dr. Chan, what are some of the technologies that has you most excited as far as improving the patient experience for folks with mental health issues?
Sure, Kate. So when we think about things like innovation, we think about incremental innovations, and we think about things that will completely change the way we operate. And I'm really excited for the incremental innovations because those are some of the things that we really could use, such as applications, smartphone apps, maybe wearable devices to kind of track our symptoms as well, but also things like social network messages where it's actually embedded in people's search queries, medical nuggets, medical information, or information about how to get mental health resources or behavioral health resources. So those are some of the incremental improvements that I think we absolutely can achieve, and the much more longer-term improvements will come from those bigger leaps, much more major technologies, brain-computer interfaces.
So, Stephen, I know that, at University of California, you work within that university system, and you're undoubtedly doing a lot of fascinating work yourself. Can you maybe share with us, what are some of those projects that you're involved with?
Absolutely. So one of the things that we were looking at is from delivering video visits. So in a much more cost-effective, administratively simple way. Peter Yellowlees, who is one of the vice chairs at UC Davis Psychiatry, has been researching this for over about a decade, where he's taking video clips of interviews, sending it off to a physician to diagnose and assess, and then send off. So that's one of those incremental innovations that is going to happen, I think, much more commonly in the near term, but we just need to validate that.
Right.
Yeah.
Well, one thing that I really appreciated with your keynote this morning for us was, as far in the future as you were looking, as far as digital technologies and all these new resources that we'll have, you ended with bringing it back to the individual, to the person, and you closed with recapping, someone that you had met who was going through an episode, and you closed with giving us an update on how she was doing. So how is it that you're trying to make sure that in your profession, it's so easy to look at the academics and the digital side and all these. How do you make sure that your field remains focused on the person?
When we think about it, it's all about the person we're trying to serve, all these different services. And I think one of the things we can improve on is having a much more systemic systems thinking, design thinking, incorporating those into what we do as practitioners. So we're trained to see people one-on-one and work on them in the clinic setting. But now we're realizing, well, there's a whole population that needs our help. And it's not just going to be doctors, it's going to be therapists, social workers, administrators too. So everyone has a big role to play in reducing the stigma, increasing awareness, and increasing the amount of treatments that are available.
Is there room at the table for the patient to be part of the design?
Yes, absolutely. So one of them, here's what's interesting, Kate. If we don't have the patient there, if we don't have the person there, we're going to make assumptions, stereotypes that we would make about them, and we'd miss the target. There's a study that came out that said, wow, hey, actually youth may not always want smartphones. And I thought, what? Youth sometimes do want to use smartphones, mobile technologies, but in the case of homeless youth, they don't want it because it's a financial burden and it's such a social burden on them that they want to not use mobile technology in some cases.
Right.
So we have to be attuned to their needs, and all of us are patients in a way.
Right.
So we all have our own experiences, and we just need to bring everyone under the umbrella. Yeah.
All right. Well, we're so excited that you were here to help us peer into the future of what's possible, but always keep us grounded in why we're here at Emerging Minds, which is helping improve the experience for folks with mental health and behavioral health disorders. So, Stephen Chan, thank you for flying out from California to be with us. We're happy to have had you.
Yeah.
This is Kate Warnock. Thanks for watching.